All right, we welcome you to another episode of Learning Stories. This is a show where we interview a diverse set of learners from the 21st century. In each episode of this show, we profile a guest who has a story to share about how they acquired a set of skills and knowledge in a creative and innovative manner. In the process, we hope to uncover a new definition of learning as conceptualized, narrated, and imagined by our guest. Today's guest, Dr. Vinayak Prakash Thattaruparambil. Vinayak, I hope I'm saying that right. Vinayak is
Yeah, yes,
actually
you are.
perfect. So Vinayak is someone I've looked up to for a very long time, and you know, we go back a long way because we were like peers in school. But Vinayak is someone that is pursuing his dream to become a fetal surgeon. He completed his MBBS from the All India Institute of Medical Sciences in Bhubaneswar. This is one facet to his personality. He is also very interested in painting and dancing. He spends a lot of his free time doing both of these things, and I will include links to hopefully some of his beautiful artworks in the show notes. Um, Apart from painting and dancing, he loves gardening, he loves writing, with poetry being a special interest. And he's also a star-crossed animal rights activist. In the long run, in terms of his personal legacy and passion, he believes that hopefully someday he's going to pioneer some medical research that helps take the field of fetal surgery and fetal medicine forward. So, Vinayak, I'm so glad you gave us this time. But just to get started and to give our viewers some context, I was looking through some of your Instagram posts, and Vinayak posts a lot of pictures about his paintings and drawings, but also there was one video where you were carrying a baby, Vinayak, okay, and it was actually a photo, and then you in the description of that photo you said the first time you realized you wanted to be a doctor was when you carried your nephew who was 2 years old, and when you saw that baby you felt like you wanted to do everything to protect him, and you knew that for some reason you had some empathy with the idea of becoming a father, and that would make you a good surgeon, right? So that was such a beautiful sort of scene, and I think we'll go into why you became like a doctor and how that happened. But Vinayak, at some point of time you were also a fetus yourself, right? And you were a little baby in your mother's stomach too. So what was Vinayak like as a child and a student, and where did you grow up, just to give our viewers a background of who you were before you became the surgeon you are today.
Yeah, sure. First of all, thank you, Abhishek, for considering to actually interview me into this. I hope I do justice to what you try to accomplish out of this, but I really hope, like people get answers or I can help people out. So, telling about myself, I'm actually a Keralite, but of Tamil origin, but I was born and raised in Bahrain. Bahrain is a kind of small, tiny island, beautiful in the Middle East. Okay, so and that's what we have in common, where we were raised both in Bahrain. So I was born and raised there. To talk about my childhood, I come from a very middle class family. My dad's, he's done his 10th and then he's just moved on to business and stuff. And this is something that happens in Kerala often where they just move to the Gulf. That's a lot of Keralites in the Gulf. So that's what my father did. And my mom's a teacher in the same school that I studied in. So it was always her passion to be a teacher. Her father was a professor. So probably it's in the line. So then so that's how my parents are. So I basically studied in the same school, which is called the Indian School Bahrain, which I'll tell you, I don't think I can talk enough about our school because it was such a beautiful place to grow up in. Because I'll tell you how it was different from other schools we had there. It was more or less like a public school of Indian culture
Right.
there in the Middle East. But when I say Indian culture, the school did not just comprise of Indian students. It comprised of Pakistan, Bangladesh, a lot of other places. So I personally, I always say that when people ask me where you're from, I always like to say that I'm a global citizen.
Mm.
And one reason for that was especially because I was raised there, and I realized that all people, no matter what, we're all we're all people, and we all want basically the same things,
True.
and we are all basically the same. So I think that was like a very good place to grow up in, which
Nice.
made me realize yeah, that we should all think of ourselves as global citizens. So, what I personally don't believe in regional boundaries
True.
is what I need to say.
That's it. That's
Yeah. So
amazing,
then
Vinayak.
that's how. Yeah.
Because it's so interesting when you introduce yourself. You put your identity of being a Keralite, but of Tamil origin. But you also, um, I think one of the things about being a third culture child, because you grow up in another country, right?
Yes.
But it's interesting how when you grow up in another country, you try staying more rooted to your identity and your cultural background in so many different ways. And I know your
Yes.
mother was a dance teacher, right? And a performing arts teacher. She also taught me at some point of time. So, um, like, and I know she was such a wonderful teacher, but the fact that you had access to her at home must have been such a luxury. But were there some things you were interested in your free time, Vinayak? Apart from schoolwork, I think kids are always interested in other things. And I know, I always used to see you win all these cultural competitions at school. I think there was
Yeah.
Ritu and Harmony, and you were like the superstar in all of those
Yes.
competitions. So was there any other passion in the performing arts space that you had growing up, and and how did that influence your thinking in general?
Yeah. So yeah. So what I can tell you about that is, I was good at studies. Maybe I don't know, but I was fascinated by science. Science was something that always fascinated me. So growing up, I had no exposure to science at home, but like you said, exposure to my mom was a luxury. I would say she's my role model. She's the kind of person who picks things up in you, and if she knows that it's beyond her, she'll find the people who can help you. So I don't know if you remember, like teachers' kids used to come to school a lot on the Saturdays when kids actually had a holiday, but teachers had to go. So she made sure that I had contact with like teachers or people, or like I can talk to somebody about all the genuine doubts I had in the academic point of view. But in talking about extracurricular, my mom's family, they hail from a very culturally diverse family. So my mom's into dance herself. A lot of my cousins, a lot of my people in my family sing. They're all into music, different forms of music, like singing and instruments and all that. So my mom would say that I started dancing even before I started walking. That's how much I love dance. And I'm pretty sure you remember as well. Like I used to be on stage a lot for that. So people would assume that I would more of go into a professional line in fine arts. Then nobody. I mean, even I, for some point of time, would have thought that I've always wanted to do. I was a classical dancer
Yep.
in Bharatanatyam. I was
Okay.
trained,
Okay.
yeah, and as well as I was I got a little training in hip hop, and like, so there was a lot of at that age, performing stuff and all that. But I always wanted to even go abroad and learn a little, do a little bit of ballet, and then I wanted to create. So I've always had this thing, okay. It used to piss my mom off a little bit. I never do anything the way I was told. So whatever I was told, I would like know everything. I would do something, and a lot of time it turns out to be just blunders, but I
Mm.
would add something to it
Right.
because I always wanted my signature and stuff. Even the style of dance, I basically learned it from her, Bharatanatyam. She taught me everything I know, but I always made sure I had a different style. So I would like go to other people and learn stuff. I don't know. It's just I always wanted my thing. So in that way, she had influenced. The thing is, then I was very much into painting from a very young. I think the most prizes and recognition I've won is for painting. Even like a lot of international art competitions and stuff, I used to take part while I was in Bahrain, and my mom made sure that I had the opportunity by making sure that every little competition she would see or anything,
It
she would
signed
like
you
tell
up.
me there is one there. She would never force me. If you want, you go, or you don't go, because sometimes you don't want to go enough. But then she
Yeah.
would tell me this is an opportunity. Don't miss it. So I always made sure I did that. then I think so. I was always culturally influenced because, like you said, she was a dance teacher at school, and I was a performer. And then eventually, I think every other performer, you get the thrill of performing and how the audience enjoy you and stuff. So I think I just started doing stuff. So I used to do a lot of things. I used to be in theater and mono act and all that. So that
Right?
was how I was in school. Yeah, I used to stay back in school for all that. So I
It's
was, yeah, I used to focus on my academics, but I don't personally think that I was like one of those kids who would like, okay, I'm gonna plan for my academics and put out time for that. I just
yeah.
always managed, but I'm the kind of person who put out time for other things.
which is
Yeah,
which is
Abhishek.
part which is part of your growth as an individual as well, right? When I like when I'm hearing you, two or three things I'm getting are your parents unconditional support, because something you said about your mother, sometimes we think parents need to have all the answers, but the fact that she was able to connect you to people that had the answers was such a great way to actually support your growth and interest, right? And
Yes.
Vinayak, I know painting, dance, um, medicine. Like what I'm there, I know there is somewhere in there. There's a fascination with the human body, because I know a lot of your artworks, and it's beautiful how you're able to capture the human body in such an accurate um, sort of way in your visual artworks, and even with dance. Like I've seen a couple of your photos. I know the expressions you bring to every performance are uniquely yours, right? And that's something beautiful, that you can actually communicate an emotion through a dance step and make the other person um, feel the same sort of rasa, or sort of emotion in that sense. And even with surgery, right? I mean, you will probably be able to articulate this a lot more, right? You said you were always interested in science, but how did that interest in science transfer into you deciding to take up medicine in medical school? Because everyone is interested. Like, if you think about it, I studied the same subjects that you studied, but how did you actually decide to, go ahead and make that like a career or a passion, or a profession?
Yeah. So this story is going to be a little long,
Go
but
ahead. We have all the time in the world.
yeah. So like I mentioned, so I made sure my academics was okay, but then I was more into all these cultural things, and then I think around fifth standard is when I realized I was fascinated by language.
Hmm.
So then I moved on to like, so I would only care about my marks in bio and English.
Hmm.
So I'm proud to say that in 12th, even though like I like screwed up a lot of exams, I was the topper in bio and English in my
Huh.
school.
Okay.
so so that happened. But I'm just saying, so I was fascinated by language, and then I think from fifth every year I was really into it. So uh, so I never but I knew that I wanted a career in science. Actually, I love animals so much. Like you mentioned, I right now I'm actually working for People for Animals in Bangalore
Okay.
as a volunteer, and like any kind of help I can do. So I've always been associated with a lot of animal activism and works related to that. So I wanted to be a vet growing up. I think my parents told me that when I didn't know the word vet, I would say I wanted to be an animal doctor. I was just so fascinated by life and animals, and so that was the thing. I was always into it. I wanted to be a vet, and everything was so set. But then I think from fifth, like I mentioned, I started getting interested in language, and there was a part of me that actually wanted to take up English, be English. I don't know where I would have been there. I hopefully someone great like you or yourself. But yeah, so that was a thing that I really liked. But then when I was 12 was when I was basically so people used to ask me, why a vet? Why don't you want to help people? So, but I mean, I know this might offend a lot of people. I really didn't. I wasn't very keen on helping people, or I was not really particularly super fond of dealing with people. I don't know, it just never hit me per se. So, human medicine was not one of my interests at all, but science was. So when I was 12, I the first kid that was born in our family, as in the next generation, because I was the youngest and my sister's like 1 year younger to me, so I don't remember anybody being kids in the family. So when I got a nephew when I was around 12, and I was here for the delivery, and in the 2 months. So I was just fascinated. I mean, I was never the kids person. Like
Hmm.
if anybody had kids, I was not the kind of guy who would go and like play with it. Nothing. I'm just doing my own stuff. I was always too mature for my age kind of kid. A little boring in that aspect. But then this kid was born, and I was just so taken aback. And I spent all my time with it because it was during the vacations, and I was in India, and I was just with the kid. I would sleep with it, make sure it was fed. I would sleep, like sing lullabies, make him sleep. If I was in another room, I could sense if he's awake. It was
Hmm.
the bond was growing that strong. So by the end of my vacations, when I came back home, I told my mom, I don't know how I don't think I can like leave him. There's some kind of stupid thing that's bothering me that I cannot leave him and stuff. So to fill the void, I eventually like I've always wanted pets, but as you know, we all grew up in flats, and
Yeah.
my parents were dead against keeping pets.
Yeah.
So, but then finally, I was so disturbed by the whole leaving the kid alone and coming back to Bahrain thing that my parents actually let me have pets
Okay.
because I was that affected by it. So that sort of filled a void. So I realized that I had this deep urge, this paternal instinct to take care of people and like watch them grow. And I don't know. I was always fascinated by birth for
Okay.
that matter, but I didn't know there was this deep connection I had for kids.
Yes.
So that was one turning point when I started actually looking into, like medicine as a prospective profession.
Hmm.
So at the same time around, I was exposed to this journal by this surgeon. Okay, so
Hmm.
by at that time, he was an OBYN, like he's an OBG doctor, obstetrician, who started uh, pioneering in fetal surgery, and it
Is
was
this
like
Dr. Kripos Nicolaides by any chance?
the person, the journal I read was not his, but
Okay.
yes, I have read about his later on,
Yeah.
and all those have inspired me. So
Got it.
that's when I realized I didn't even know there was something called field surgery. Even right now, I don't think there are a lot of people. So I just read about this and I realized, wow, this is so amazing because birth is something that's always fascinated me,
Hmm.
and the fetus and birth, how this whole thing happens, from conception till birth.
Yeah.
So it's so, I don't know, it's hidden, but it's a lot of curiosity that's surrounded around this for me at least.
True. True.
So yeah, so then I saw as a kid too. I used to read up a lot on this, like how birth, how things happen and
Sure.
what are the about a lot about. I was really into genetics as well, so I
Got it.
used to read a lot about DNA and stuff when like we were in eighth and all of it. So it was a little, yeah. So it was very hard for me to understand, and I would just read a lot of books just to get some idea of how these things work. And it's not like nobody around me could help me a lot as well. But whatever little information I got, I think that's how I got close to a lot of teachers at school, because I would like after school sessions when they're free, I would go and ask them, can you tell me what's actually this, what's this,
Right.
and
I mean,
stuff like
you
that.
were a very precocious sort of like student in a lot
Yeah.
of ways, right? When like you had like an inclination, but I feel like what really stands out about you, Vinayak, is you were very curious, right? You were very curious about the world around
Maybe
you,
too much for my own good, I would
and
say.
and sometimes that can be isolating, right? Because when you feel like you cannot target the cute, but then I feel like like the beauty of children or like students is, right, they're, and as adults we sometimes forget to do that, right, to just follow your curiosity where it takes you. You're never going to hear like an adult, and you may actually, I mean, I'm generalizing here, but the fact that you were interested in birds, or the fact that that experience of seeing your nephew actually being born transferred into getting a pet, and that transferred into you actually choosing um, a particular branch of science, which is biology and not physics and chemistry. And I think I always thought surgeons and doctors are magicians, right? If there was somebody that was as
So
close to, but then you probably know the process, but
yeah,
and even with choosing a specialty, right, Vinayak, I know that in medical school you actually choose your specialty much later.
Much later, much
So,
later.
just to backtrack a little for a lot of our listeners that don't really know what the whole process is, because a
Mm.
lot of high school students actually listen to this podcast, and many of them are not very sure about the process of, and again, I know it's different in different countries, but
No,
if
no,
you could
that's okay. I can generally say what's going on around the world in
right,
med schools.
perfect. So
Yeah,
maybe you can
yeah.
just tell us, like after high school, I assume you studied science for about 2 years in the school
Yes,
system that we were in, and
yes.
how does one apply to medical school? What's the process, and what was your experience in medical school
Yeah.
like?
Sure, sure, man. I want to talk about this because I had no clue.
Okay.
I had to do a lot of study. I wish there was somebody who would talk to me about all this. So I had totally no exposures. I didn't know any doctors in the family, as friends, or like absolutely no doctors.
Mm.
So I didn't even know till like I think second year of med school that surgical and medicine, they're like two different main branches of the whole medical sciences.
Hmm.
So I didn't even know this. So I didn't even know that when I wanted to be a fetal surgeon, that I would have to like do surgery for a long time to be a fetal surgeon. It's not like you do like you. It's not a common thing. Like you can just choose a specialty. It's a longer process. And the more I got into it, I realized it's more tedious. So
Hmm.
what happens in India usually is you have an entrance exam that is universal for everyone, and once you write that, you're ranked according to however the results come out, and then you can apply to the institute according to your rank basis. That's how this goes in India. So what I did, so I wanted to be a vet. Like I said, I had this thing back of my head where I was curious about fetal surgery. I just read about it and it just fascinated me. But see, I was it was like you always knew you wanted to be a vet.
Yeah.
So you're like, okay, this is what you're focusing on. So I in eighth standard, when I came to India, I spoke to a vet. So my uncle was working in the government service, so he had contacts. So I spoke to a vet, and he told me that there's something called coaching. You have to undergo coaching to crack your entrance because a lot of competition, especially in a country like India with this kind of population, it's near to impossible to crack any sort of exam.
Sure.
So that's when I realized, okay, I'll have to leave India. I mean, leave Bahrain, my home, after 10th.
Hmm.
So my parents weren't very keen on it. They were like, why don't you leave after 12th and take a year off and prepare and then do it? But at that point of time, like I was always a hyperactive kid. If you remember, I was doing a lot of things at the same time. I was studying and I was doing this. I was in the school prefectorial council all the time because I just needed to be busy all the time. So I couldn't just sit still. So for me, losing a year in preparing sounded like, oh God, it's going to be a long year. So what I did was I told my parents, I convinced them it's okay, I'm going to live alone for 2 years because my parents couldn't leave. I have a younger sister, and basically, to be frank, the source of income for my parents. So it's like, and both of them needed to work.
Yeah.
So if my mom was going to leave a job and come to India, that wouldn't help. Like the whole system would collapse,
Yeah.
whatever, like the economic system in the
Yeah.
family. So they needed to be here, and I was like, it's fine. I'm gonna go alone. I'm gonna manage. So I left after 10. Then I joined like an institute where they were coaching you for entrances as well as I was doing my school. So
Okay.
for medical entrances in India, your board marks are not counted.
Okay.
So I never focused on academics anymore because I was like my whole goal is to get into some good
Medical school.
veterinary college and
Mm.
yeah. So what happened in India was a tremendous thing because I moved from a different country and home and I was going alone and living in another country
True.
in a hostel. And I've always lived in home, like I've
Mm.
always lived with my parents. I don't have any kind of that exposure. It was a, it was a roller coaster of 2 years. Uh, in my personal opinion, I think it was invariably very important and relevant. That was a drastic step, but I think I was a little too young and a little too unprepared. Uh, Despite what I wanted to believe was like that I was, and uh, the two worst years of my life is how I describe my 2 years because one thing is the stress with the school and the entrance. You can never balance both. It's the stress is immense.
True.
Then I think living alone, living in a different country where people have very different ideas
Yeah.
about life, and
Yeah.
so the things you believe in and they believe in are like so different.
Yeah.
And and then definitely the difference in the setup, the
Yeah.
facilities available. So that was one thing I was thinking would affect me, where like I wouldn't be okay with like the type of toilets. I would tell that frankly, like
Yeah.
a lot
Yeah.
of things like that. Yeah, I was worried
Because
about hygiene and stuff. Yeah.
and because as I mean, there is a large non-resident Indian diaspora around the world, not just in the Gulf, but in North America, all around the world. And
Yes.
what's
Yes.
interesting is you get used to certain comforts in life, and then
Yeah.
you know even because were you born in Bahrain, Vinayak, or were you
Yes.
like
Yes.
you
I
were?
was
And it's
born
because
in Bali.
what's interesting is when you're born in another country, right? And then they tell you that you are from India. And that's something we have in common, Vinayak. I'm also from South India. I'm from Karnataka.
Yes.
And but if you think about it, people from Karnataka, Kerala, Tamil Nadu, Maharashtra, each state has its own language. Sometimes when you move from one country to another, you feel like it's going to be a homogeneous experience. But everyone speaks a different language, they have different cultures. So as an Indian, you are constantly trying to you know grapple with this identity of being Indian, but also being Keralite and being like it could be Europe in its like all these different countries in Europe in its own way, right? So because
Yeah.
you moved, I mean, once you gave your medical exam, you got into like one of the premier institutes, medical institutes in the country, which is the All India Institute of Medical Sciences in Bhubaneswar, which is the state in Orissa. And in Orissa, the languages or the I know
Yeah.
it is not South India, it's more East India. And I'm sure you
Yeah.
met
Correct.
people from all over the country in terms
Yes.
of like background. And so, what was it like for, Vinayak that stayed in Bahrain and he was with his family, but then now after, but I feel like the coaching also prepared you for that little phase of, because I know medical school is very intense in terms of
Yeah.
what they give you. So, how did you adjust in AIMS and maybe how did I mean, what do people do in medical school? I'm curious, I'm very interested in it. So like, go ahead,
Yeah.
you can choose to answer any question.
Yeah. So the first question I would like to answer is about, you were talking about the identity crisis. So for me, that was something that never really bothered me, because I believe in my roots. So that too. See, the thing is, I am actually a Keralite, but of Tamil origin. So
Mm,
when I was in Kerala, I would learn Tamil from my friends because I wanted to know Tamil.
mm,
Okay, because I knew that that part of me was
sure,
Tamil. So I think there was this innate thing in me to relate to everybody. So I'm telling you this one thing, even somebody who looks, I mean, who seems to be so different from you are, you have at least one thing to relate with them.
sure,
I don't know what it could be. Maybe it's that you two are in the same place at the this point of time. So I never had an issue, and I've had friends from very young age. I had friends from all over, like different places. Like my best friend growing up was from Pakistan,
mm,
and I know when you come to India, it's such a big deal. It's such a big deal because of all the issues, whatever that's going on. But where I grew up from, so those were the things that bothered me when I came to India. Where I grew up from, that they were like my closest neighbors. We used to play every day.
mm,
So there was no difference. We were all expatriates there.
yeah,
There you are from, yeah. But even then with Arab kids, and you common that you are actually living in the country. So I never had an issue going to different places and communicating. Or I speak like 8 languages, so that
wow,
doesn't matter as well. So I was
really,
always
what are
comfortable
the
speaking
eight
Malayalam.
languages you speak, Vinayak?
Yeah, okay. So, first of all, of course, I speak Malayalam, Tamil, so like my mother tongues. Then I'm definitely comfortable in English and Hindi. Then actually I speak because I was in Odisha for 5.5 years for my med school. So being a doctor, the first thing you should know is to communicate with patients. So,
Mm,
and that's the longest I've lived in India, uh, like in a place in India, five and a
mm,
half years. So I'm very fluent in Odia. And then our neighboring state was West Bengal. So we had a lot of patients from West Bengal and Bangladesh. So I was kind of okay with Bengali. Then yeah, then and then that we learned French in school.
yeah,
So I took it to another level, I think around ninth, because ninth I started finding it very hard to learn. I started with the tuitions.
Yeah.
And then going for tuitions, I realized, oh God, there's so much. Once you get a grip on, like I told you, I was always into language. So I wanted to. So what I used to do, remember all these paragraphs and letters and all that. So at tuitions, you had exams. So for that, what I would do is I would actually try to increase my vocabulary by actually writing things out of the box, like actually write a letter about something. So there might be a lot of mistakes, but from that you learn. So
Yeah.
I was actually really good at French by
Yeah.
the end of 10th, but
Wow.
now I can maybe read and write, but speaking is like all gone. But I really like put in a lot of effort in French during that time. Then I learned Telugu because Telugu was a neighboring state when
Wow.
I was working in
But,
Bhubaneswar, studying and working and all that med
but
school.
eight languages, I don't know what that is. Like a lot of
Yeah,
people, I mean, two languages seems like a lot to too many people, but
yeah.
it's also part of your identity of being a doctor and being flexible in different contexts, right? When because I mean,
It's definitely helped me
yeah,
where being like somebody who's like multilingual and being a doctor.
yeah,
But I wouldn't say that would be like a thing like
like
I like because yeah, because a lot of people who come to med school, they're brilliant yeah, people, but not might not have the same kind of predisposition to a language, because a lot
true.
of science people really don't like languages. So I remember we had classmates who were like really good scorers in physics, chemistry, math, and Hindi. They would like score really bad, and they would just hate Hindi for that reason, because their total marks come and all that come down. And so I think language and science are like two different lobes of your brain, but it's good if you have like an
An interest
affinity
in
for both.
both, sort
Yeah,
of. Yeah, that's pretty
kind of
cool.
helps.
I
Yeah.
mean, we actually digressed into like languages, but going
Yeah.
back into your experience,
Yeah, so you want to know about how med school works. So I'll tell you this. If anybody, see, I've noticed one thing is where anybody who's a doctor, and any kid or any parents proudly say, when my kid wants to be a doctor. I've actually noticed this as a kid. Nobody ever encourages you. No doctors ever encourage you to be a doctor. And I was like, what is the problem with them? Are they like worried about the competition that this kid's gonna grow up and like, gonna be a competition? But no, it's just that the course is what it's so the right word would be, it's so involving. Like you have to involve every part of you, your mind, your body, and your soul, and like everything. It's like it's like pawning off your soul to the devil,
yeah,
sort of thing. So you have to be so like you have to give up a lot.
sure.
And there have been days, even recently, I'm pretty sure you've heard about a lot of recent issues happening in India, where there's a lot of attacks happening against violence happening against
Yep.
doctors.
Yeah.
So this has been a concern for us for the past 2 to 3 years.
Yeah.
So I was part of the Resident Doctors Association in AIMS Bhubaneswar, where we actually had a strike and march, and like we fought against to bring in more rules for
Wow.
protection of doctors when
Wow.
that issue happened in Kolkata
Yep.
in NRSMCH, where there was actually a lot of issues and a lot of violence happening against doctors in
Yeah.
Kolkata. So this is a major issue. This is one of the issues that we face. But to be honest, so there are days where you should actually weigh if things are worth it or not. So anybody who would tell me they want to be a doctor or they want to go to med school, I always tell them this is a big step, this is a long step. And I honestly, my opinion, which might be wrong, you should only take up medicine if you're that passionate about it. Because if you take it up for any other reasons, at least at some point in your time, you're going to be really upset
You're going to
and
be burnt
really,
out, right? Because the hours are
yeah,
so long. And
yeah. So it's, if I can start with all the things. First of all, it's the, we advise everybody to have proper sleep, proper diet, proper exercise. We have none.
mm,
We absolutely have the worst lifestyle of any human beings known. And not for the reasons that some who are unfortunate people have to face it. I have gone like a whole day without a meal because of my, just because I was working, which is
mm,
which is not right, which is not right for anybody for
yep.
that matter. But that is one day. Sleepless. I have 36-hour duties every alternate day now,
Wow.
on alternate day basis.
Yeah.
So that is how much sleep deprived I am on a regular basis. You can see the dark circles, so it's very obvious. So there are a lot of things like this, and then you might not have a social life. a personal life, and any personal life you had, the more you get engrossed into work. So I started working recently because I graduated in 2020. So the like from internship, I what I noticed was, so now my current thing is like I'm trying to always have a work and personal life balance,
Sure.
because it's absolutely so hard for
Yeah.
somebody who's passionate about it.
Because I think
So
eventually it hits you, right, Vinayak? And eventually, if you don't like take care of your health,
sometimes it doesn't have to be eventually. It's because you have other people in your life
right?
and you actually don't treat them the way they're supposed to, be treated, and then
It,
a lot of things fall apart. And yes, it's really affected my personal life, where I'm a very passionate person
yeah,
about anything for that matter. Like what the things that I like, I'm very passionate about. But as you may also know, I am very bad at things that I don't like. So I am one of those. I'm an extremist. If I'm good at something, I want to be the best.
mm,
So that's what people saw in school. Oh, he was good at that. He was good at this. I was bad at some, like I was bad at a lot of things. I'm pretty sure. I remember, Abhishek, you were like really into sports. How many times have you seen me on the ground? I was terrible at sports, and I never even tried. One thing, I had my plates full, and then the other thing was I couldn't stand being not the best at something.
sure. And
So
that is, I mean, that is like a natural proclivity of us, because we want to be. Um, I think competence, the idea of competence in any sort of domain, is sort of a basic human drive and need, right? And if you think about it, when I know like doctors, they go through, I think it's the longest period of like training ever, right? So it's 5 years
yeah,
of
yeah.
med school, then you do your residence for I think
Yeah,
three or
so
four
in
years.
India, it's like this: 5 years, 5.5. Now they've decreased. It was 6 earlier, but by the time like our we were all joining, is 5.5 years of med school. Then any years taken away to either work or prepare for your post graduation exams. Again, that's an entrance and whole process. Post graduation is 2 years, and super speciality will be another 2 years. So this is how, I mean, post graduation is 3 years, and
That
super speciality is 2 years. So
and
this
you're
is
also
how.
working as a resident at the same time during your post graduation.
So after your graduation, basically any kind of studies you're having is actually work.
Got it.
Everything you're learning is through work. The only difference,
Got
you
it.
have exams. Otherwise,
That
it's
makes
just
sense.
like work. Yeah,
I mean, and
and
then
this
just
and
just just to backtrack a little bit, Vinayak, like in the 5 year course, is your
hmm,
first year like an open ended sort of like how is each
no,
year structured in like
yeah,
a medical
yeah.
program?
So I had no idea about how med school was going to be. Like I don't know what year had what and all when I joined.
Yeah,
So the thing is, in India, I'll tell you how the system is. Outside now, a lot of places they're trying to bring in broader subjects, which is really amazing and commendable, into the first year and second year of med school,
mm,
so that they have a wider perspective of things. I am actually I've been working since my internship. There's something called medical education,
mm,
which is a team of people trying to evolve and update the medical education system, especially in a country like India, which is very conservative.
mm.
So bringing in new stuff. So I've always loved teaching. I told you, it's in my genes, my grandfather and my mom. So I've always wanted to teach. So this is one thing we are focusing on. So what I am working on now is actually teaching through dance.
Mm.
So I have actually performed a couple of places, but then because of COVID, now I'm not able to do those medical education conference performances anymore. So I've been taking up different topics in med school and actually expressing it through dance, so that it's more acceptable and it's easier for people to understand than just like telling you how this patient feels like. For example, in a psychiatric illness, what somebody is going through, I can definitely do it better through dance.
Mm.
And definitely being good at art has also helped me, because like you said, surgery is all based on anatomy, and so if you're good at drawing, you can actually, like, it helps you with surgery. So all this multifaceted things have actually helped me in my profession. Now coming back to our system in India, in first year we have three subjects. They're called anatomy, biochemistry, and physiology.
Mm.
So anatomy is basically what people say, dissecting the dead bodies sort of thing. So that's where you dissect a whole body in different parts and find out all the things that you're supposed to. That is part of anatomy, and then you have to definitely study the anatomy of everything of a human being. Then biochemistry is basically like the name suggests, it's all about the chemicals, hormones, and whatever all the lab tests, a lot of lab tests that we do are basically biochemistry, testing your urine, testing your blood for things. So all that's part of biochemistry. This one basic subject, which is very relevant, especially in, like the now generation now, where we have a lot of technological advent helping us, help patients.
Mm.
Then physiology is basically every kind of system that works in your body, how it works this way and why it works this way is taught in physiology.
Got it.
Then coming to second year, when we have four subjects, uh, the four subjects are, one is pathology. Pathology is basically about every cell and tissue.
Mm.
So you've heard about biopsies, and when something is removed from your body and sent for testing, that is tested by a pathologist, and they will find out what cell is where and why this has happened and help you with your diagnosis. Then we have microbiology. Microbiology is, like the name suggests, like the study about all the organisms, creepy crawlies, all the bugs that are supposed to bother you. So it's basically that's microbiology. Then we have another subject that is pharmacology. Pharmacology is basically, like the name suggests, study about all the medicines. So which is as important, especially nowadays. Then we have another subject called forensic science. Forensic science is basically, like the name suggests, anything to do with autopsy and investigation and
Mm.
all those things, finding out what happened to somebody
Got it.
and stuff. And the legal aspect of medical, like that
Yeah.
also includes protecting the patient and protecting the doctors as well. There are a lot of laws to help
Yeah.
us help people. So that comes under forensic. So the thing is, these are the subjects I'm mentioning are the exams we are giving. But from second year now, we have a subject called community and family medicine. The
Hmm.
exam we usually give it in third year, or in our colleges we give it in final year in AIDS and all of the aim. But they're changing that too, because a lot of stress. Because in final year you have a lot of subjects, so you
Sure.
shouldn't have to give to the three additional three exam. I mean, the third year we actually have three subjects exam, which in all the aims we give it with the final year, because third year is a year which we don't have exam, but now we're
Okay.
changing it.
Okay.
So that community and family medicine is something that's picking up all abroad. In
Hmm.
India, I hope it does. So what they are doing is actually what is the basis of medicine,
Hmm.
where you are actually taking medicine to people and helping people
Hmm.
at the level of people. So community and family medicine is all about helping community and informing them, creating awareness, and like those are all the policy makers, and they make all the policies and laws regarding all vaccines, and how to help people, like acknowledge what how can they go about medicine, how can they reach a doctor, how
Hmm.
can they talk about things. So all that goes on this in community and family medicine.
In the third
So
year,
from our
right?
third year we have, yeah, no, this is, yeah, so basically we give the exam in third year, but we start learning about it from second year.
Got it.
So a third year is when we actually have our clinical subjects, the hospital subjects. So till
Hmm.
then we had all these subjects that help us study and understand. So now in the third year we have all these subjects where those are the departments that when you go to a hospital you see, okay, these are the doctors that you see in person. So they are in third year. We have all the clinical subjects, which is ENT, which is ear, nose, and throat. Then we have ophthalmology for the eye. We have orthopedic, sorry, for the bones.
Hmm.
Then you have general medicine, which is basically dealing with all your infections and anything, like any kind of illness, you can go to a general physician, which is usually a general medicine person. Then the
Hmm.
same way we have general surgery. General surgery is anything to do with surgical in your body will be seen by a general surgeon.
Okay.
Yeah. So this is the broad classification that we have. Then we have other two subjects which are very important are pediatrics, is for children, and obstetrics and gynecology, which is for women, and pregnancy and stuff
And
related to
and
that.
is this something that all students have to go through, no matter
Yes,
what
yes.
okay,
So the
because
five and a half years is for every med student. The
so
five the courses that we go through.
so
Yes.
basically you are in that period of time being introduced to the nuances of every medical sort of sub-discipline, right? Whether it's
No,
opt
I am already done with that. I'm already graduate. So
Correct. I mean, when you are in medical school, you probably
yes,
learn a little bit about, because I
everything.
assume not everyone knows what they want to get into, and it's important to
Yeah.
be able to
So
figure out.
yeah, so that was the like the weirdest thing. So I probably don't know anybody who knew exactly what they wanted when I joined, and I joined in a prestigious institute like All India Institute of Medical Sciences. So there were really a lot of smart people, and there were a lot of people. So if at all anybody already had in mind like they want to do this, they didn't want to do that.
Yeah,
It was probably from what they've seen from their parents. A lot of our med students have parents who are doctors,
got it.
so yeah, so they have a rough idea about things like that. So but then for me, I don't think I've met anybody like me who has like read a lot about these things, and just that is a soul. So the I had advantages and disadvantages. I wasn't really open to a lot of things, uh, because I already knew what I wanted. So I would
Mm,
focus on the subject. Like I told you, I'm an extremist. So that comes with a lot of difficulties. I cannot do well in things that I don't like. So they're all, and I'll tell you, even if you like, now I want to do surgery. When I go to surgery, and in surgery, or there'll be something I don't like. If I go to pediatric surgery, or there'll be something that I don't like. So till I reach my niche, okay, and I'm hoping there is nothing that I don't like in fetal surgery, but I'm going to always not be good at something, which bothers me because I am a control freak. At least I'm trying to get out of it, and I've come a long way, but I used to be. And you realize those things when you're like doing med school and stuff. Maybe as a kid, those things don't bother you much because you're in a safe environment.
yeah,
But once you're like living on your own and doing things that are stressing you like day and night, you realize being a control freak causes a lot of issues.
sure.
So I had a lot of issues being a control freak. So but the thing was, the good part about knowing what I wanted was, from first year I focused on the subjects that I knew would help me or that I liked. So, like example, in anatomy, we have a portion called embryology. That is to know how every organ and every child, fetus, has developed from conception till birth,
Got it.
how each organ came into being, and what can be done, what are the diseases, what are the congenital defects that a child can have. So
Sure.
that was like one of my favorite subjects. So I just like, like would just read up a lot on that. Then, like I said, anatomy was one subject I really liked. So everything would have something to do with fetuses and embryos and
So
children. And
you would find the angle that, and I
yeah,
think it
that
was
was
an
that I want.
advantage. The fact that you
Yeah.
knew it so early was actually something that worked in your favor, right? Because you could customize your training into that direction. And
Yes, that's what I'm saying. So that helped me that way. But as a medical student, you're not expected to be very very partial to anything. You have to get the equal exposure to everything, and that is, so I had an equal exposure. But I can tell you I was always a little biased. So I
correct.
can tell you the same thing went on for all the years. So I would focus on what would affect kids more and focus on that. And I think when clinic started, like I was more focused on pediatrics and gynecology and
So the
obstetrics.
last 2 years are when you actually go into like a practice sort of
Clinic.
setting. Got it.
Yeah. So the thing is, from second year we get to go to clinicals, just to like postings and stuff. You see, you get a little exposure of what they're doing. You get to understand little bits, but it's very vague. It'll take a
Mm,
lot of time. So in final year at least, you're able to see like a patient and assess them, like take history and examine them for like basic things. So by final year at least you get to that level.
mm.
But yeah, the last 2 years are more fun because you have a lot of clinics. You start interacting with patients then. So before that, it's more of the studies and like any other college. I would say any other college, like
Fascinating.
your classes, regular classes and stuff. Once clinics
That's
start your classes, but you have this clinical setup which makes you feel a little like doctor. You start wearing your white coats. People notice you. You notice people noticing you, and then
that's
it's
awesome,
all
and it's so interesting to think about how you go through that sort of space, right? Because every surgeon in the country probably goes through something similar or something along the
yes,
same lines, but
yes,
and
definitely.
like recently, when I like that's something a lot of people don't know about me, but I'm very interested in reading memoirs of doctors in the field talking about their experience. So, like one of the memoirs I read was by the surgeon Atul Gawande. I and he wrote a book called Being Mortal. And in the book, his basic
Hmm.
premise was that um, at the end of someone's life, it's not always necessary to extend their life. it's important to have a conversation with the patient to see what they want in terms of the end of their life. And that was just very interesting because it showed me like the human side of medicine as well, right? I think there are different sort of like schools of thought on like, and I suppose that's geriatrics or like another discipline in terms of that. But then also what you said about the hours being so brutal, right? Because as a doctor, like one parallel I drew with teaching, every student thinks that they are the most important student in the world, right? In the classroom. And even patients, they come to you and they think that they are the first patient you're seeing the whole day, right? But then you are seeing 20 patients, and through the day, you're expected to be as attentive with all these 20 patients. And even mistakes, right? Humans make mistakes. And as doctors, you try your best to master this. And I think being a control freak in terms of mastering the science, because like surgery is such a important process. It's somebody's life. And I remember another Instagram post you put up where, and it was beautiful because you said after 8 years of two people trying to be a parent, you were part of the process that gave them a baby boy and a baby girl, right?
Yeah.
And
Oh
I
God, that's
and
so big.
I was actually looking up the definition of fetal surgery, and it says it's a procedure performed in an unborn baby fetus in the uterus to help improve the long-term outcome of children with birth defects. So in a lot of ways at that point when you intervene, you can change the life of that particular family and that baby. So you know like like help me understand a little bit about the professional life of somebody that's a fetal surgeon. And I know you have you can't share stories because you can't give names and you need to protect the identity of your
Oh yeah.
patients. But there is, if there's any like experience, like you share some photos of those without naming names, could you like share some stories of very touching moments in terms of like medicine and your ability to practice fetal, like the story of the parents with after 8 years? I mean, I can't imagine the emotions they must have felt when they saw their
Oh God, they
babies.
they send me photos of the kids growing up, and now they're like 3 years old this
Yeah,
year. They keep sending me photo like the kids still amazing, they're fine,
that's
healthy,
amazing.
that's what.
That's amazing.
So yeah, that's so the thing is I'm a long way away from being a field surgeon. So I can tell you about field surgery, which is very little, because there's actually very little things happening all around the world.
Hmm.
First of all, there might be like there's a two-digit number of actual fetal surgeons
Oh,
trained to do field surgery.
okay.
So basically, it's taken up by people who have done pediatric surgery, and it's their forte now, which is why I would have to do all this. This is for a long path for me right now. So in India, we have a couple of surgeons performing pediatric surgeons performing like one or two procedures
Hmm.
of like fetal, because the fetal surgery is still at its like conception. They're like maybe like 6 7 procedures that are regularly done or that can be done, that's advised and
Hmm.
that is declared safe by research and trials. A lot of procedures are under trial and a lot of them have bad outcomes. See, the basic principle is this: if a kid has to undergo surgery when it's a fetus, the kid is in such a bad state already.
Hmm.
So the chances of survival for that kid is very little.
Sure.
So that is naturally very little for that kid. So any procedure done on that child to increase its chances of life, you need to have done it on enough people to know if it's actually helping people. But it's very difficult. There are a lot of it's a very fine line. There are a lot of ethical issues, and there are a lot of schools of thoughts regarding field surgery. The programs being shut down in a lot of countries. A lot of countries are against fetal surgery. It's also a lot of. I remember talking to one professor once because, like, I talked to a lot of people abroad because, see, to learn this itself is so hard. There are very few people who are actually doing it. So imagine learning and teaching. It's
Hmm.
another level. So so I remember asking, so any kind of help I get or any kind of information I get, I try to collect on it. So I remember asking one pediatric surgeon, he's like, that's something that's a branch going to die. Do you want to go into a branch that's gonna like sink? Is what someone's asked me. And then I know personally a lot of pediatric surgeons who tell me that they don't believe in intervening
Mm.
in nature's course at that point. So see, these are all different thoughts, and I respect everybody's opinions. Uh, but that's what. See, I don't know what are the qualities of a good doctor. I mean, I should being a doctor. I might know. I don't know if I agree to what everybody thinks. Um, I think what makes me help people is the fact that I personally am more fascinated and enjoy doing surgery, and I'm glad it helps people. But it's I'm not doing this because I'm not doing this because oh I'm glad I did not want to be a doctor because I wanted to help people. I'm glad what I'm doing helps people. I wanted to be a surgeon. I wanted to be a doctor just because I enjoy doing it. Like as
Mm.
simple and basic as that. So a lot of people might get offended by this point that I've made. But what I tell you is, I think when you love what you're doing, you don't complain, or you don't have anything negative to think. See, I told you. So I am somebody who believes that life is really short and
Mm.
every moment counts, and that's something I learned in med school. I've
Sure.
seen a lot of people who shouldn't have to die at a very young age at the wrong time pass away. It was
Sure.
so heartbreaking when I was studying, and I that those are the times when you actually start thinking, why is this happening to people?
Mm.
And then I realized life is too short and beyond anybody's control. So I always tell people that it's you have to be safe, you have to do everything right, but live a little. I
Mm.
always tell people live a little, because life is taken for granted, I would say.
That's so true.
So
I mean, because
nobody should.
we
Yeah,
don't
please
we
carry.
don't actually acknowledge the fact that there are so many things out of our control, right, Vinayak, in terms of genetics and the environmental impact,
Oh
right?
God, God,
You
yes.
can't control the diseases you may have inherited, and that is sad but also beautiful because it makes you realize that the few things you can control in your life, it's so important to give your 100% to it on a day-to-day basis, right? So yeah, I think yeah, we have a slight tech glitch here. It should be sorted out in a couple of seconds. Okay. Vinayak should join us in a couple of seconds, and this is part of the whole idea of technology not coordinating when it has to. But I thought I could use this time to maybe uh, talk about some of those books that me and Vinayak were discussing. So one of them is Being Mortal by Atul Gawande. I highly recommend that particular book. And it was actually a book that had a real influence on me as an individual. And another one was a book by Paul Kalanithi. He's again a neurosurgeon. Um, he wrote this book in uh, he realized he had cancer at some point of time in his medical training, and uh, it was about his experience training to be a neurosurgeon, and then how he thought about his legacy, even though his life unfortunately ended so early, and why he practiced medicine in general. And another one is by a British neurosurgeon, Henry Marsh. Again, I'm forgetting the names, but he wrote about his experience as a neurosurgeon in the British medical community. So these were just some books I thought I'd recommend in terms of like general suggestions. Um, yeah, and also the Netflix show, The Surgeon's Cut, um, is something I really enjoyed watching. If you just want to understand more about what very competent professionals do in this field. Each episode in that show is actually a profile of a particular medical professional in a different discipline. So there is a heart doctor from India, there is a fetal surgeon, like Vinayak mentioned, from the UK. Hey, Vinayak, can you hear me? I can't hear you, Vinayak. Sorry. No, it's okay. I think you'll have to leave the call and come back in again, Vinayak. It should be fine then. And that's completely okay because I was just telling them about. Oh, wait, let me see. Did I? So I think. Oops, sorry. Ask to. I'm here. No. When I do this, why don't you log out and log back in again? I think it should be fine if you do that. Wait, let me see. Okay, me and Vinayak are just gonna figure this little technical. Yeah, the same. Okay, so as Vinayak comes back again, I was talking to you about the Netflix show, and it's what I really like about that show is how they actually give you an insider's view of what the life of a surgeon is actually like, and I highly recommend um, actually watching it and seeing it just to take your conversation forward in terms of your exploration of this discipline. Um, Vinay, can you hear me now? No, that's really odd. So maybe there should be like a mute button on the left hand side or that you. Mm, yeah, I can see you, Vinayak, but I can't see if you remove your earphones. Will that help, Vinayak? Or Okay, so what we're going to do is there's a slight technical glitch here, so we're going to be a little creative. Vinayak is here on the call, and I'm going to ask him the question in the chat. Um, and what we're going to do is sort of convert that response into um, me actually narrating it for you. Yeah. Awesome. So my last question, Vinayak, is that, you know, with COVID, and I think all of us completely understand the importance of health, right? We understand that if we are not able to control something, it can actually have larger impacts and it can become like a global pandemic. And I know you're very passionate about how the medical community is generally perceived. And I think health is also like a public health situation. So when I my question to you is, let me just type that out in the chat. How do you doctors? Um, can you hear me, Vinayak? Can you hear me? No. Okay, doctors. Um, So my question to Vinayak was generally like his thoughts and comments about um, the role of doctors uh, in the country of India in specific, and how they handled the COVID pandemic. And and I think what Vinayak just wrote in the chat is that from his perspective, he feels that every state and every institute is doing whatever they can, and it's fair. I think he doesn't know as much about it because he's focused on a specific aspect of this discipline. But I feel like that's a good positive note to end this particular interview. And what I will do is I will post the recording, and I think we got to learn a lot about the medical profession in general, and the idea of learning from the perspective of someone that actually went through that in terms of medicine or just becoming a doctor. um, so thank you so much for your time today, and until our next time, keep learning, and stay tuned for more episodes on this particular podcast and video interview show.